Alright guys, let's talk about diabetes and Wharton Jelly stem cells. Diabetes, especially diabetes type 2, has become a rampant problem in today's era. There are two kinds of type 2 diabetes. Basically, it's either we are not producing enough insulin or our body has become resistant towards the insulin. Now, these problems usually arise from an organ in the body called the pancreas. What stem cells can do is, as we develop diabetes, our pancreas tends to function less. At the same time, diabetes is a progressive problem whereby if not taken care of properly, it can cause damage to other parts of the body. For instance, it can damage our circulation, it can damage our nervous system, it can damage our eyes, it can cause ulcers, wounds will not heal properly. So, how stem cells can help us when it comes to diabetes? Number one, stem cells has the ability to repair the pancreas. So if the pancreas can be repaired, therefore the insulin production can be rectified. Number two, stem cells has the tendency to repair the signaling system between our organs, our cells. So when the signaling system is repaired, the insulin resistance tends to drop as well. Therefore, our body will be able to use the insulin at a better rate. Thirdly, when there is damage to organs in the body, for instance, if your nerves are damaged, stem cells has the ability to repair the damage that has been done. So you are looking at reducing the side effects or the problems that have arisen after having diabetes. At the same time, for those who have ulcers or wounds which have come up from diabetes, stem cells can also be used to regenerate and repair the skin, the soft tissue, the ligaments, the muscles that have been damaged because of the diabetic ulcer. What I have seen based on my experience dealing with patients with diabetes is the ability to, of course, most importantly, reduce the glucose range of the body, trying to bring it back to a normal range without too much of dependency on medication. Then we are also able to reduce the damage that has been done. So I have utilized the Wharton Jelly stem cells to repair diabetic ulcers. We have used it to repair muscular or ligament injuries which have arisen from stem cells, and we have been getting very good results using Wharton Jelly stem cells. When it comes to diabetes, we need to use stem cells that has the capability to multiply into a variety of cells and organs in the body, because diabetes is a complex and also a very general disorder, meaning it affects majority of your organs and it affects multiple parts in the body. Therefore, my advice would be to use mesenchymal stem cells, especially Wharton Jelly stem cells, because of two reasons. Number one, we require a higher dose of cells, which usually cannot be attained when we are doing fat liposuction, stem cells from fat, or when we are using stem cells from the blood. And at the same time, number two, we require cells that has the capability to diversify, which is also not able to be done using blood cells as well as fat cells. So mesenchymal umbilical stem cells are usually the go-to when it comes to problems like diabetes. The sooner you pick it up that you have a problem, and the sooner you try to correct it using stem cells, the better the results are. The longer you allow the diabetes to damage your body, then the therapy that may be required at that point will be, of course, more complex, and the stem cells will also be, we may require multiple sessions of the stem cells for us to actually achieve therapeutic goals. So my advice for those of you with diabetes is, if you are developing diabetes, we call this period pre-diabetic. If you are developing diabetes, or if you have been diagnosed with diabetes but it is still relatively very recent, then the best time for you to come and get the stem cell therapy is now. If you already have diabetes, not to worry. Come and see us, let us do investigations and understand what is going on, and then we will customize a therapy for you using Wharton Jelly stem cells.